Good afternoon. Welcome to the City of Memphis and Shelby County Joint Task Force Media Briefing. My name is David Sweat. I'm Deputy Director with the Shelby County Health Department, and I'm the person in charge of the COVID response unit at Shelby County Health Department. I want to give you a few updates today regarding our statistics and numbers. We are this afternoon at 26,903 reported cases. We've also had 370 deaths reported in Shelby County, which represents 1.4% of the cases who've been diagnosed have been fatal. Our median age of death is 73, and the range is 13 years to 100 years old. The number of cases increased from yesterday by 247 cases, and so that does represent a higher number than we've been experiencing in most recent days, and that's twice this week that we've had more than 200 cases reported on a given day. In terms of we've had some questions from the public and officials and others about our progress against the various indicators for improvement versus setbacks that were laid out in Health Directive number 11. And we'll give you a brief update on that. As far as opening up new businesses or releasing some of the restrictions that have been placed on businesses, there were 8 indicators laid out in the Health Directive number 11. We have only met 2 of the necessary indicators, so we still have a way to go. The 2 indicators that have been met is we've had an improving trend for 2 weeks in terms of the number of cases reported. So we've met that indicator, and we're averaging right now less than 180 new cases per day. So we've met that indicator, but the remaining 6 indicators that were laid out are failing. So our positivity rate is still too high, and we are not experiencing the 30% declines week to week in terms of number of new cases reported, et cetera. So we will continue to monitor that and update people on progress against those improvement indicators on a weekly basis. In terms of the statistics, we have some slides to share today. This is a breakdown of our cases by age that have been reported as of August 26th, which is yesterday. And what I would call your attention to is that 80% of the cases that have been diagnosed in Shelby County are less than 55 years of age. So we do see, in fact, half of the cases would be less than 44 years old or less than 45 years old. So we do see that the younger age groups are where the epidemic is most active in terms of its transmission and in terms of the number of cases diagnosed. Next slide, please. When we look at our distribution by race and ethnicity, we have represented 58.9 or almost 59% of cases are Black or African American citizens. About 20% of the cases have been diagnosed among our Caucasian or white citizens, and the 21.5% is all others combined. In terms of our ethnicity, about 21% of the cases are ethnically Latinx, but 80% of cases are not. And that's for cases reported overall. And the next slide, please. When we look specifically at our pediatric cases, we're at over 9% of the total number of cases have been less than 18 years of age. And the disproportionate share of those born by our minority populations, 53% of the children have been Black or African American, and another 31% have been other than white. And as far as ethnicity, 31% of the pediatric cases are ethnically Latinx, and the rest are not. That is a disproportionate overrepresentation for children who are Latino. And next slide, please. So as I mentioned before, 80% of the cases have been less than 55 years of age at diagnosis, but 88% of our deaths have occurred in people 55 years of age and older. So as has been the message throughout the epidemic, we need everyone working together to protect those at increased risk. And right now, being 55 years of age or greater is an increased risk of death from COVID-19 disease in Shelby County. And so we do continue to need everyone to stay the course with hand washing frequently, use of hand sanitizer, disinfecting surfaces, social distancing, wearing a mask whenever in public, and avoiding large gatherings, even 10 or greater people, we would say is to be discouraged whenever possible. So practice the social distancing, wear the mask, practice good hand hygiene and respiratory etiquette, and protect yourselves and the people that you love. Thank you.